I'm back with Mark Kmek talking about choosing family health plans, and I'd like to welcome back Michael Parkerson from Blue Cross and Blue Shield of North Carolina. So many of us, Michael, are trying to be good consumers when it comes to finding the best deals, whether we're at the grocery store or at the car dealership. So how can an average person dive into the complex world of healthcare and find savings?
Absolutely. It comes down to this whole concept of consumerism that we've been talking about. So really engage and ask your physician questions. Start with your in-network provider, go to your primary care physicians, and ask about alternative treatments. Understand the cost behind that. If you need a prescription, ask if a generic is right for you. Many times it is, and it'll be a lot less expensive for you. And then ask where's the most cost-effective place to get treatment. That is one of the #1 things that we can do as consumers.
Ask your doctors where?
Absolutely. Ask your doctor about that. We also provide tools at Blue Cross to help you understand, because the cost varies widely between different providers. So we have a new tool that we just launched several weeks ago on bcbsnc.com on the member page that will allow you to see how those costs vary between different providers so you can make the most informed choice at the end of the day.
Michael, what about your choice of where to go for care? Does that influence the cost?
It has a significant impact. We all know that the emergency room is really expensive. When you have the need for care, decide what is the appropriate setting. Consider an urgent care, or actually consider a primary care physician. Many offices are staying open later and staying open on weekends. But when you decide where to go, make sure you're getting the appropriate care. Father of 2 daughters, I understand completely. Emergencies don't happen during office hours.
Right.
So make sure if you do have an emergency, go to the ER if that's the appropriate thing to do. But we do know that your plan design and your level of consumerism will drive the type of ER experience that you have. So we know that our HSA members actually use the ER a third less than our PPO members. And we attribute that to the consumerism, how they're using that HSA fund as their own money and being smart shoppers.
So we're talking a lot about choices, Mark, and consumers have choices, employers also have choices. So what are you thinking about when you're trying to decide what is best for your coworkers?
Well, as you know, in this day and age, unfortunately, escalating healthcare costs have made it quite challenging for employers, especially in our economic times when our profits and revenues aren't allowing us to grow that budget for that insurance plan like we would like to. So what's critical, I think, #1 is the role of a benefits advisor. It's a very complex world out there. There are many choices that employers have, and I find that I try to put myself in the employee's shoes, and what I want to be sure of is I'm going to get the most amount of money for both that the employer is going to spend for the employer as well as the employee, because we do share in the cost of those insurances.
Many of us get our health insurance through our workplace. Are there cost-cutting strategies there, or are employers just simply trying to keep their own costs down?
Well, I guess the answer to that is yes and yes. Clearly, we do have budgets, and clearly healthcare has become increasingly a bigger percentage of our overall cost to run an organization. But having said that, I think what's critical is you can be smart and you can find ways to shift the design of your plan so that it's at the most advantageous both to our employees and the users of the insurance, as well as the bottom line cost to the company.
Do you seek feedback from your coworkers on what they're looking for when it comes to plans?
Oh yes, we have open enrollment meetings each year, and we try to listen closely as to what their needs are and hopefully provide those choices, because as I said earlier, each of those plans has their advantages, and we hope that they'll find the best one for their needs.
We are certainly absorbing a lot of information. You're doing a great job providing the answers, but we're going to take a quick break before we wrap up with our segment with a few key questions.
The deal is this: $5 for a baby aspirin is unacceptable. These hospitals are ripping us off.
Strong words. For the hospital's take on this, we turn to Emily Gray. Emily.
We know what their take is. They say they charge more to cover those who can't afford care. And that money also goes to cover things like nurses and orderlies. I mean, when does it end? $50?
Let's stop looking for scapegoats and start talking. We invite you to an open, honest discussion about how we can all rein in medical costs at letstalkcost.com.
And the bedpan issue. Don't even get me started.
Thank you very much, David.
So what are you really implying?
My doctor made a mistake, and I just feel like I have the right to do something about it.
Isn't it true that what you're calling medical malpractice is really just a frivolous lawsuit cooked up by your attorney?
She objects, Your Honor. Sustained.
Let's stop looking for scapegoats and start talking. We invite you to an open, honest discussion about how we can all rein in medical costs at letstalkcost.com.
Man, she's good.
Welcome back. We have one final discussion with our entire panel, Michael Parkerson, Mark Kmek, and John McDonald. I'd like to thank each of our panelists for joining us today, but before we go, we have some important points to talk about. Michael, you referred to ER cost a little earlier in our show, and it's really astounding how different the cost can be from going to an ER instead of your regular doctor or to an urgent care, can it?
Absolutely, the cost difference is pretty dramatic. Multi-factor times difference between if you're going to an urgent care provider's office or you're going to an emergency room. So what we find with our HSA members is they're actually using the hospital and ER less, but they're using it for more serious conditions, which is exactly what the ER is intended for. It is for those more serious, more acute conditions. So we feel that utilization is appropriate.
And John, we talked a little bit about HSA myths. I'm sure there's a lot of confusion out there. What types of things are you hearing?
Well, whether or not a person is, it's only for healthy, wealthy, or young people. Do I have the same network? Do I, it's complicated. And quite honestly, it isn't. As Mark had said earlier, it really depends on your healthcare needs, whether it's right for you in terms of it being for the right person. But as far as being not healthy enough for it, or too old, or not wealthy enough, those are myths, because really it is just a upfront deductible that everybody gets to participate in an HSA at the same level. The networks are the same. There is no difference in the network between the traditional PPO network or a qualified high deductible health plan. And it really isn't that complicated, because essentially it takes away all the complications of a plan that we're normally used to with copays. What's it paying for and things of that sort. Right now, you have an upfront deductible, and then once that deductible is satisfied, it's paid at 100%. And then you actually have the power to decide whether or not you're going to take money out of your own health savings account to pay for those expenses on a pre-tax basis.
And there's a tax benefit.
There's a tremendous tax benefit when you really think about it. Almost 30 cents on every dollar that you're putting into that fund is tax-free. You're saving that amount of money. And as we said earlier, very different than a flexible spending account is, you can start, stop, and change the amount you're putting in there. If you have a balance, you don't have to rush to spend money. You can save it, you can roll it over, you can take it with you. So there is a lot of flexibility within the savings account.
Mark, there are so many options and choices for choosing a health plan. Can you give us some strategies on how best to do that?
Well, first of all, I think it should be a joint decision, obviously, with the family, and probably a combination of two things, calculation and prediction. I know none of us have a crystal ball when it comes to our own health or the health of our families, but we can take a look at what has the past been as far as frequency of doctor visits or regular prescriptions that we take. And sometimes also we have the option of elective surgery that may be very significant, and that could be a good time to really take a hard look at what would be the most beneficial plan for those circumstances.
And what worked last year may not necessarily work this year. It could really depend on your health and your family status, can't it?
That is absolutely true, and we do give our employees a choice once per year. And we gave that choice for the first time last year, and although I never like to see our employees or their families have any type of illness, I can tell you that just recently 2 of our employees who had elected the high deductible plan with the HSA, very healthy families, unfortunately faced into some serious difficulties, and now are looking at an out-of-pocket cost that's less than 1/3 had they had chosen the traditional PPO plan. So
wow.
In that regard, it's one less thing for them to worry about as they focus on the health and for their family to get better.
And John, once you're enrolled in a plan, the decisions are not over. So could you give us some tips on managing the health insurance cost?
Right. Well, the biggest theme around qualified high deductible health plans and HSAs is really to be a consumer. Be a healthcare consumer. Treat it as if you were buying a stereo system or a new car. Really understand the moving parts, and that's really what has to happen after you go through the open enrollment and you've selected the plan. Document. Keep a file on all healthcare expenditures on the family so that you actually can gauge how much benefit spend you're going to have for the given year. But also be informed. utilize the tools that many insurance carriers and health plans make affordable to you, where you can go and you can look at standard fees. You can look at and understand how prescription drugs are tiered. We all know about the tiers of tier 1, 2, and 3. What is in that tier? Learn about generics. Get your physical. One of the good things about the healthcare reform is we now all have a physical afforded to us at no cost. There's no reason that you shouldn't have a primary care physician and you should get an annual physical, because you can't manage what you don't measure.
Right, you talked about learning about generics. It's important to ask the pharmacist, isn't it, about generic? They don't always offer it up.
Absolutely, and again, it really depends on your particular need, that particular makeup of the drug itself. And as we all know, we're all anticipating the major removal of the brand name Lipitor that is going to become a generic later in the fall of this year.
Now, Michael, sometimes we have to submit claims, and that process isn't always cut and dry and easy. Can you help us understand the best way to do that so that we can make it easier for ourselves?
Absolutely. I think there's a couple key things you can do. First of all, make sure your information is up to date, both with the provider as well as with the insurance company. That'll help make sure the claim gets submitted correctly the first time through. But if you do happen to encounter a problem and you're a Blue Cross member, we have a team of service professionals available for you. So you can use the 800 number on the back of your ID card, or what we're finding more and more people are adopting is using the websites. So you can go to mybcbsnc.com and actually manage your account yourself. And we're finding that many more of our members are doing just that.
A lot of us go to the doctor and the doctor's office submits the claim. We don't have to be concerned with that. So who are we talking about? Who fits into this group of people who will have to submit it for themselves?
Absolutely. If you happen to go to a non-participating doctor outside the network that we talked about previously, you'll probably have to submit the claim yourself.
Okay.
So make sure you fill out the information correctly. But if your physician's office is actually submitting that claim for you, make sure you give them your most up-to-date ID card at the time of the visit.
As we close, gentlemen, could I ask you to each give us one piece of advice for managing the expense that comes with health insurance and health care?
Yes, be engaged, be a consumer, be active, practice good health behaviors, and get involved with your health care plan so that you're informed on how it works, understand the process. Don't be a healthcare consumer, don't be just a healthcare user.
Okay, Mark?
I think with some of the changes we talked about today, what's important, people do change jobs more often today than perhaps when I started in the business world. And I think the fact that things are portable and can be taken with you and can be used whether or not you're with your current employer for 1 year or the next, and also even left beyond that is very important.
And Michael?
Yes, I think when you take a look at the information available to you, make sure you use all the tools that are available. Being that consumer is going to be really paramount and the best advice to give. Then when you start taking a look at all the different avenues that exist for you, make sure that you are living a healthy lifestyle. Your health is way too important to take for granted. And then last, I would encourage you to join the discussion at letstalkcost.com. Share your ideas on the solutions as we work together to understand how we can control medical costs long term.
All right, well, that brings us to the end of our program. And once again, I'd like to thank you, gentlemen, for joining us. Again, we'll have more information about all the topics on the website, letstalkcost.com. Thanks for joining us.